Ladies and gentlemen, thank you for standing by, and welcome to the COVID-19 Media Briefing Conference Call. At this time, all participants are in listen-only mode. After the speaker's presentation, there will be a question and answer session. To ask a question during the session, you will need to press star 1 on your telephone keypad. Please be advised that today's conference is being recorded. If you require any further assistance, please press star 0. I would like to hand the conference over to your speaker today, Mr. Mike Schumer. The floor is yours.
Thank you for joining us for the COVID-19 media call for July 8th. Today's speakers will be Minnesota Department of Health Commissioner Jan Malcolm and Infectious Disease Director Kris Ehresmann. After their opening comments, we'll open it up for questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Around the world, as of early this morning, we were above 11.8 million cases of COVID-19 and above 544,000 deaths. In the United States, as of this morning, we were just a few thousand cases shy of the 3 million mark and over 131,000 deaths. Here in Minnesota, we're announcing an additional 463 cases today, up from yesterday, bringing us to a new total of 39,589. The median age of our cases does continue to trend down. The daily death total was up 8 from yesterday. 5 of these deaths occurred in residents of long-term care facilities. The age of the fatalities reported yesterday was 2 people in their 90s, 2 in their 80s, 2 in their 60s, 1 person in their 40s, and 1 in their 30s. The 30-year-old was a person with no known underlying conditions as of this time. The person in their 40s had at least 1 underlying health condition. Geographically, 2 of these cases were from Hennepin and Olmsted each, and 1 each in Anoka, Dakota, Ramsey, and St. Louis. The hospital situation remains fairly stable. 265 patients currently in the hospital, 122 in intensive care. And again, these are the COVID-related hospitalization numbers only. This result today is based on a lab testing volume of 7,651 processed as of last night. That is an increase from the prior day's total and what we sort of expected to see following the holiday weekend. So we hope and expect that laboratory total will continue to increase. We've seen a 12.5% increase in total testing over week, and a 7.9% increase in new cases over that same time period. The 7-day average testing positivity rate is 4.4%, which is an increase from the 3.6% test positivity rate a week prior. Again, we use a 7-day rolling average for this positivity rate to kind of smooth out some of the day-to-day variations. And the testing positivity rate does have a 5-day lag factor to allow for the complete capture of the cases. I will just mention before turning it over to Kris that we are beginning to see some re-emerging supply chain challenges with respect to laboratory supplies nationwide, with some of the supplies being kind of redirected to some of the hotspot states and just continuing case growth, which is happening around the world as well as in the United States. With that, I'll turn it over to Kris.
Thank you, Commissioner. And I will build on what Commissioner Malcolm said. You know, as we look at what's happening in other states with the significant outbreaks that they are seeing, we recognize that that increased demand for testing will have an impact on the supplies that we need here in Minnesota. So we are continuing to monitor that situation, but wanted people to be aware of the fact that, as the Commissioner said, we are starting to be aware that there could be supply chain issues. We also want to acknowledge that there may, in addition, be an extension of lab processing time. So in other words, if specimens are being sent to labs outside of Minnesota, the demand from across the country can mean that the time it takes to get those lab results back may be extended. So just want people to be aware of that you may need to be prepared for a longer wait time for lab results. Many of us are used to being able to go to the doctor and get a test result the next day, which is wonderful, but that may not be possible with this increased demand. Some of the national labs are reporting that they're running 4 to 6 days to get results out, which means that it may take up to 8 days if you're counting the day of collection and the date, for the provider to contact you. So just want people to be aware that we're continuing to monitor the situation nationally, but we may see some impacts on Minnesota at this point. Staying in the testing vein, St. James, Minnesota is doing some community testing today, so I just want to remind you that we're partnering with the City of St. James and Watonwan County Public Health to offer COVID-19 testing in St. James today. This is in response to an increase in COVID-19 cases in Watonwan County. Testing is free and available to anyone who wants to be tested. It's being offered today from noon until 7 p.m. at the St. James Middle and Senior High School. Anyone who wants to be tested is encouraged to come even if they don't have symptoms of COVID. No insurance or identification is needed. Residents of Watonwan and neighboring counties are eligible to be tested, but we encourage those who live farther away to be tested at their local clinics. You can find more details about testing options on our website. We're grateful to all of our partners, especially local public health, for helping to make today's testing possible. In terms of long-term care visitation guidance, I just want to highlight that our guidance for window visits and outdoor visits at long-term care facilities has been out for several weeks. Residents in these facilities are at greater risk for severe illness from COVID-19, so we do want to reiterate for people visiting loved ones that they follow the guidance of staying at least 6 feet away from people, including the person that you're visiting, and that they wear masks. We understand the impacts of COVID-19 on our long-term care residents and their families, so we know that these visits are really important and a very important way to connect with loved ones, but we want to make sure that all visitors help to keep the visit safe by following the social distancing guidance and masking guidance. And then I want to comment on a concept that we've been hearing about recently that we're not particularly enthusiastic about, and that is COVID parties. I've been hearing from various sources that some people may be organizing and attending a COVID party, presumably as a way to get COVID at a time that may be more convenient to them. I just want to say, and I'm sure you're not surprised to hear me say this, that this is a really, really bad idea. Not only is there a small but real risk of a significant illness and complications in young people or anyone who develops COVID, but there's also a real risk that the virus would be passed along to other family members and even people in the community who would be at much higher risk. So I just want to let you know that if you're thinking, oh, let's just do this and get it over with, it's really playing Russian roulette. I know that we talk about the groups that are at highest risk for complications of COVID, and age has something to do with that, but that does not mean that younger individuals do not have serious illness. And as we've talked about, we've had at least 3 deaths in healthy 20-year-olds. So just wanted to bring up the concept and let you know that this is something that we've heard about, that we are very concerned about, and that we are discouraging. And with that, I will turn it back over to Mike Schomer.
Thank you, Kris. We'll open it up for questions now. Reporter, I think we're ready to take questions on the line.
At this time, I would like to remind everyone, in order to ask a question, kindly press star and the number 1 on your telephone keypad. We will pause for just a moment to compile the Q&A roster. Your first question comes from the line of Jeremy Olson from Star Tribune. The floor is, you may now begin to ask your question.
Thank you. The mayor of Edina had issued an appeal on the city's Facebook page on Monday for young people to take greater care. And he had said that contact tracing had found things like bonfires and cabin trips and things like that were causing a spread amongst the teen population. You guys do all the contact tracing, so I'm wondering if you have a sense of what has caused that doubling in COVID cases among teenagers in the past month or so.
This is Jan. I'll let Kris give the main answer to that, but just to clarify, there's quite a partnership in the case investigation and contact tracing work that is certainly led and directed by the State Health Department epidemiologist, Kris's team, but in many cases it's actually our local public health partners that are doing some of the case, contact tracing in particular. But Kris, I'm sure you've got some perspective on the trends.
Sure. A couple of things. Yes, the mayor was absolutely correct in his assessment that there have been a surge in young adult cases in Edina, many of them reporting attending house parties, bonfires, cabin weekends, as well as some sports teams that have reported exposures. Some of the sports teams were not only together for their athletic activities, but also attended some house parties and cabin weekends. So those are some of the factors. There was also a report of a very large party that was held in late June, and that there were a number of positive cases associated with that event. So, we recognize and we appreciate the mayor's admonition to young people to make sure that they are practicing social distancing and taking precautions. But we want to acknowledge as well that the surge is not restricted to Edina. The surge that we're seeing in young people, cases in young people, is not restricted to Edina. Young people from across the state are accounting for the bulk of cases in the last 2 weeks. And any activities where you have people in groups where they cannot socially distance means that there's a greater likelihood of transmission in those settings. So we're definitely seeing a lot of cases in those age groups, and in part it's because they're engaging in activities that we know are so natural, so fun, and so normal for youth. But in the time of COVID, we need to make sure that we're asking people to reconsider some of those activities and make sure that they're doing them safely.
And my follow-up question based on your final opening statement is any of this due to then COVID parties? Do you have evidence of those actually causing an increase in transmission in Minnesota, or is that more just a theory?
I can't say that I think these parties were intended to be parties for the sake of a party and social events not intended to be focused on spreading COVID, although they certainly accomplished that goal as well. But we have heard of the idea that people have considered having a party, not necessarily just for the social purpose, but as a means to share COVID, and we want to discourage that. We don't want to discourage people being able to have interactions with others, but if they do, we want to make sure it's done safely. And clearly, a COVID party would not be a situation in which people would be masking or social distancing.
But just to clarify, you don't know through contact tracing or whatever means of any actual outbreaks in the state involving that kind of COVID party?
Yes, I'm sorry. I didn't say that explicitly, but you are correct. We do not have any evidence of transmission at this point because of that kind of party.
Thank you.
Your next question comes from the line of Emily Havoc from KRE11. You may now begin to ask your question.
Hi, Jan and Kris. Sort of along those same lines of the contact tracing with young people, more specifically with that 20 to 29 group in Minnesota, what are you finding as you continue to contact trace with those people? Is it largely bars and restaurants still, or, I mean, the numbers look large enough to me that it's hard to believe they're all, people at crowded bars, but I guess I don't know. What are you seeing in terms of trends now?
Kris, you want to take that?
Sure. We are continuing to see bars and restaurants as a significant source of exposure. We've had, several hundreds of cases from those types of establishments in the last week. So it really is a significant exposure. And so there's the exposures or the transmission that would appear to have happened in those settings, as well as the subsequent transmission that may occur from those first individuals to their contacts. But yes, bars and restaurants continue to be a significant source of exposure for our younger population.
And just following up on that, is there any more talk in the health department or with the governor about, I guess, implementing some new limitations on bars and restaurants again as we see those spikes?
This is Jan. And I think as we discussed last week, this a situation that we and the governor are monitoring closely, looking not only at Minnesota data, but what we can learn from other states and the role that specific environments are playing in some of the spikes that other states are seeing now. I think as I mentioned before, we are really appreciative of the fact that the hospitality industry, some of the trade associations and the leaders in that sector are very well aware of the importance of this, of if we're going to be open and even at reduced capacity, which is a desirable thing, I think, for a lot of reasons. But if that's going to be able to sustain, folks really have to comply with the executive order guidance and requirements around capacity limits, social distancing, not having people standing around in bars, but seated only, strong preference for outdoors, all of those things. And we've really, I think the governor has wanted to encourage and frankly give some time and some space for proprietors and Minnesotans to understand that the way to keep these environments open is to really comply with the guidance. So that's sort of been an intentional, let's see how this goes strategy over the last week and more, and we continue to monitor the situation really closely. But yes, that conversation will continue as we learn more about our Minnesota numbers.
And if you let me have one more follow-up here, in general, the positive testing rate going up to 4.4, how concerned are you about that? This seems like a fairly large increase to me from 3.6.
Well, yeah, it is. It's a notable change in a fairly short period of time, and it's certainly an indicator that something has changed in recent weeks, and it's not altogether surprising given what we're seeing in other states and just given the continued increase in social interactions that we're observing. The question of, and I think the value of the different metrics that we are looking at daily and weekly is to come at this from a number of different directions. It's certainly good news that the hospitalization picture has remained quite stable. It does seem to reflect that, again, it's just another indicator that the recent cases are heavily skewed toward younger populations. But as Kris says so clearly and so well, the concern not only is for the health of those younger people getting exposed, which still can be very serious for them, but it's the second and third generation transmissions from those younger cases to higher risk members of the community. So that what we're really going to be looking for is how do these numbers and the age demographics change in the next 2 to 3 weeks. Kris, you want to add anything?
Well, the only thing I'll add, and I'll say this, I'll say I have a caveat even as I'm saying it, because I don't want to suggest that increased positivity is good, because it's clearly a metric that we're looking at and monitoring, because as the commissioner said, we want to see that, we want to make sure that we're not seeing a huge increase in new disease in Minnesota. But one thing to consider is when we see a small increase in our positivity rate, it may be that we are doing a better job of targeting. And the reason I think of this is because, for instance, the testing that's being done in St. James and was done in Madelia last week was really focused on a community where we thought there may be community transmission, and it was more of a targeted testing event, in which case we would expect to see a slightly higher positivity rate because we really were reaching people that needed to be tested. So I don't want to suggest that a high positivity rate is a good thing unconditionally, but there are some situations in which it reflects that our testing is really reaching some of the populations that we need to reach.
Thank you.
Your next question comes from the line of Catherine Richard from Minnesota Public. You may now begin to ask your question.
Yeah, I wanted to go back to the testing supply shortage you mentioned at the top. Do you have any evidence that that is somehow playing into these lower testing numbers we've been seeing the last few days? Any concern that that's why we're not getting over 10,000 tests daily?
I think this is Jan. I would say I think that the testing numbers from the recent days is not an unexpected reflection of the holiday weekend. We do know that there have been some supply chain issues already in the last couple of weeks, but we still, with current supply availability, we still have more capacity available in the state. But I think we wanted to flag this for folks because we literally just as of the last couple of days have been getting more intelligence from the health systems themselves that their supply chains are being impacted, as well as from the regional FEMA office that supply issues are kind of reemerging, just given what's going on in some of the high outbreak states, getting priority for some of those supplies.
Okay. And a follow-up to Emily's question just a moment ago, you described, what you guys are seeing in bars in terms of social distancing and that kind of thing around the state, but how do you know that? Do you have people out there just surveying restaurants and bars and other places where people gather to see what sort of practices are in place?
Yes, we do have staff, from local public health and from local law enforcement, different divisions of different departments that have various regulatory responsibilities, just conducting some proactive visits to see how things are going. As well, certainly the areas where there have been clusters, we appreciate the voluntary closure of some of those establishments, but we certainly are kind of in close contact with those that have had cases associated with them. We also get a fair number of citizen reports through the state duty officer and the Department of Public Safety, as well as social media. There are just lots of feeders, if you will, into the system. So, Kris, anything you'd add?
No, I think you covered it. But there are regulatory folks who have gone just done a check, a visual check later in the evening, so not during normal business hours. So they have had eyes on situations at times when there are more people in the bar or establishment and have seen crowding.
And are they enforcing anything? Are they saying don't do that? What did they do other than report back to you?
Oh, yes, definitely. They will work with the establishment. As the commissioner said, this opening and this seeing cases in these locations is something that has just been happening, and so we've really been working with them as we reach out to talk to them about the situation to say, what are you doing? How can you do it better? How can you do it more safely? So our goal is to help them be successful. But yes, they're not just eyes on and saying, oh dear, there's a terrible problem, I'm going to go home. We do reach out to the facility and provide them with guidance and assistance.
Okay, thank you.
Your next question comes from the line of Carla Holt from KRE11. You may now begin to ask your question.
All right, thank you so much for taking my question. I did want to ask, I'm sure that you're not wanting to address the school situation every day, given that it's still dynamic and you haven't made your ultimate conclusion yet, but there have been some recent developments related to the president suggesting that he would pull federal funding from schools that do not reopen in the fall. And of course, the CDC chief also coming out in favor of opening schools. And I wanted to see if you would at least respond to those two comments and those two developments on that front.
So this is Jan, and I'll certainly invite Kris to comment as well. Members of her EPI team have been very closely working with the Department of Education on thinking this through and on making sure that we're looking at the latest evidence on safety in schools and transmission among kids and the like, as well as keeping close track of evolving CDC guidance. I think what I would say is that we certainly agree, and the governor, I think, has been very clear about this in recent days too, how important it is to get kids back into the school environment for their learning. The Department of Education, I think, has done a really wonderful job of supporting school districts and schools and trying to make distance learning as effective as possible, but they have been clear from the get-go that they know, we know that distance learning is not a uniformly successful experience and leaves a lot to be desired particularly from a child development perspective and a health equity perspective and an educational equity perspective. So I think we just would absolutely say that it's a shared goal to get kids back into the classroom, but again, to do so in a safe manner that protects certainly the students, but also the teachers and the staff in those facilities.
And this, even as our staff are helping to provide guidance on the discussions related to school opening, we're also looking at how we can best monitor activity in schools so that we can, as the commissioner said, ensure that it's a safe learning environment for both staff and teachers.
And is the expected decision date for that still the end of July, or is there any possibility, given how much the conversation is ramping up in Washington, that decision could come out sooner here as well?
I think the governor has certainly expressed an interest in having that timeline move up to the extent that we feel like the analysis and the preparation has been thorough. So all I can really tell you right now is that we're working very actively on it between the Health Department and the Department of Education.
Thank you.
Your next question comes from the line of Darren Benson from TTOE Radio. You may now begin to ask your question.
Thank you. I know this is an old topic, but I'll bring it up again. Are we going to see any update to the Minnesota model anytime soon? I know one of the individuals involved in that was on maternity leave, you said on a previous call. Any chance we see a new model anytime soon?
I think I've just asked that question recently. I'm going to talk with the staff at the Health Department and the U that have been managing that process. I know that they do continue to work on updating the model. I haven't heard a specific date for when they intend to rerun it. I would expect that will be certainly in the next several weeks, but it's not imminent. As far as I know, it's not planned for a rerun of the model, any sooner than 2 or 3 weeks from now. It would be my estimate. I'll certainly give you an update on that if we get a little more precise time window.
And I know you talked about that was just one part of the data that you were analyzing related to COVID-19. Being the fact that there hasn't been an update in quite some time, is there other factors that you're weighing more heavily in your analysis right now without that model present?
Yeah, and you're absolutely right. I think we've tried to suggest from the beginning that the model is not about a specific prediction and is not intended to really give us direction on specific policy adjustments. The model has never really particularly driven decisions around various reopening strategies and the like. Rather, it is broadly instructive about what variables have the most impact on changing transmission and hospitalization and outcomes. So that's where we got really focused when in the first runs of the model that showed what a huge difference ICU capacity made in outcomes and what a huge difference reducing social interactions made in the speed of transmission. So it confirmed those things for us. What we are looking at, and I think you're aware of the specific metrics that we post every day on the so-called dial-back criteria that look in a more real-time way at case growth, at testing volume, at trends in new admissions into the hospital, in the percent of community spread, as well as a number of additional surveillance indicators that we look at within the health department, what we can see in the healthcare utilization data about the types of conditions people are coming to the doctor for, going to the emergency room. So there's quite a rich set of data and factors that we look at, but I would certainly, point you to those dial-back indicators as, perhaps some of the most significant variables that we're looking at.
Thank you.
Your next question comes from the line of Jeff Bainan from Associated Press. You may now begin to ask your question.
Thank you, Commissioner Malcolm and Kris. Why is it that Minnesota seems to be doing so much better than other states that are seeing a reemergence and becoming hot zones all over again, seemingly in the West and the southern United States? Is just Minnesota being a lot more cautious, so it's having to avoid slowing down reopenings, or what have we done better than other states that are just seeing a surge in cases?
Well, I think that's it's a great question, and one that we really need to keep digging into to understand whether our more favorable experience in recent weeks, we would love to think and hope that the data continue to hold, that this is a result of a more incremental opening strategy that the governor has taken over the last 6 weeks or so, rather than kind of opening everything at once. We've been through a number of stages of more gradual opening of certain sectors and, starting with, outdoor only or lower capacity levels and incrementally moving up. So that's been a very intentional strategy to try to, as we've said many times, not prevent the spread of COVID, but to manage it, to control the rate of growth. But we want to just make sure also that we're not just seeing a timing artifact. For us, I think a sobering thing was realizing the importance of giving it an appropriate amount of time before you can really judge the impact of policy decisions or environmental kind of impacts that have happened. I think we've learned from some of the states seeing a resurgence that it happened more like 4 weeks after major policy changes to reopen, as a result of perhaps people who are out and about earliest when things start to open up tend to be the younger folks, and then after a period of time, not only have they been exposed, but several weeks later they've exposed others, and on and on. So I think it's been sobering to us to realize that the time window for judging the effects of things might be a bit longer. Kris, what would you add?
No, I agree with everything you said, Commissioner, and I think that timing of judging things, there's a lot of pressure right now, understandable, from the public that we need to do more faster. But what we're seeing is that some of the states that have opened up are seeing a lot of disease, and I think that our thoughtful approach is a positive one, and I think that we want to be continue. We don't want to be locked down any longer than we need to, but we also want to be thoughtful because, as you said, we don't want this to be a situation in which we're just in a better spot with timing. We've said that we expect that it would take at least 21 days following a reopening of something before we would really have data, and what we're seeing is that we need at least that much time. So we're grateful for where we're at, and we want to make sure that we continue to stay in a good place.
Thank you.
Your next question comes from the line of Jeremy Olson from Star Tribune. You may now begin to ask your question.
Thanks. Commissioner, on Monday you had unveiled the new dial-back metric of a more per capita case rate that you said you could use to compare with other states. But I also wondered if this is going to be a tool for kind of a regional approach going forward in Minnesota. It would seem like it'd make it capable for you to implement policies in high-need parts of the state or states where counties where there are hot zones right now or lots of cases versus other counties. I'm just wondering if you're thinking about using that metric to measure regional variations in the state and whether that might result in regional policies rather than statewide policies.
It's a great question, and we do track all of the measures on a regional basis, and both to inform potential policy decisions, but also for other mitigation strategies. It's just to help to point out where do we need to dig deeper, where should we perhaps do some targeted testing, as Kris said earlier, where do we need to ramp up, certain kinds of messaging, perhaps. So certainly there's action that we can and need to take that is regionally tailored, and certainly there have been discussions, always continue to be discussions about should some of the guidance be tailored regionally or some of the rules around executive orders. The challenge of that, and there's some appeal to that, just given the fact that the circumstances are different from region to region. However, just given how much people move around and the speed with which an event in one region can have impact on another, thinking it through, how well would a regional policy strategy work? There's just things to consider about what would you do with just movement around the state and how would you control for that. So, but certainly the granularity of the data and the ability to look at it regionally is really valuable for healthcare and public health interventions.
And with that in mind, there's been continued discussion of mask recommendations. Obviously, some cities have their own policies in place, and it sounds like the state's kind of reaching a bubbling point where it's going to make a recommendation on that or not. I just wanted to check with you on that. Can you give an update on where the state is at on consideration of some kind of statewide or regional mask requirements?
Yeah, as we talked about, I think last week and earlier this week, we've been really appreciative of local communities considering this and taking actions, and that's often how things go in public health. The local action, which then kind of builds momentum for statewide action. So the discussion about, we've been doing just a lot of research. Governor and governor staff have been talking with others about their experience in what difference do mandates make in use rates. I think the governor's been super clear all along that this is strongly recommended and one of the most important things we can do, and that he believes that Minnesotans really need to see the value in this and own it, and not simply as a matter of mandates. But we are looking digging out data as we speak on whether the addition of a mandate really drives usage rates in a different direction, and are there variations between statewide approaches and local approaches. So just a continued discussion, and as per some of the other questions, there are a number of issues that the governor's looking at around the data, around kind of next questions about what schools and the like. So I think you might expect to see some of these things getting kind of considered sort of in relationship to each other over the coming couple of weeks.
Thank you again.
Operator, we have time for one more question.
Your next question comes from the line of Jill Burkham from Star Tribune. You may now begin to ask your question.
Hi, I joined late, and so I'm sorry if you've addressed this, but I'm wondering if there have been any outbreaks in Minnesota daycares, and what does the data about childcare tell us about the risks of opening Minnesota schools this fall?
Kris, I'll ask you to take the lead on that one.
Sure. Just a couple of things. First of all, just by way of background, the Council of State and Territorial Epidemiologists, which I'm sure no one ever thinks about except us, but that's the group that collectively helps to define, make case definitions for various diseases and things. The CSTE definition for an outbreak is 2 or more cases in a child care. So with that in mind, we have a very low threshold. And if we look at all child care settings, we've had 125 programs that have had at least one case. 30% of those, or 38 programs, have had 2 or more confirmed cases. So that would mean, an outbreak. And only 8 of those programs have had 5 or more confirmed cases. Most of the cases have been among staff, 66%. And we have not had a lot of evidence to date that the staff infections were the result of transmission from kids or between people in the center rather than being, an exposure in the community. So we have seen cases in child care. We don't have a lot of evidence that the transmission is occurring in child care. It's more in the adults. And I can say that if you recall from a week or so ago when we were talking about some of the cases that we were seeing in young adults who that were associated with bars or other establishments, we noted that several of those individuals had reported working in child care settings. So just kind of giving you all that information.
And then can you talk a little bit about, does that I guess indicate whether or not we could open up schools? How valuable is this information in making that decision?
We would be looking in, and I think as the Commissioner alluded to, the Department of Health has a role in providing, obviously, data and our expertise in terms of disease transmission, but there are a number of factors, including the fact that schools are really essential, that are all being weighed. But certainly we're looking at what we're seeing in child care settings, what we're seeing with youth sports, any of those activities to see what kind of transmission are we seeing and how does that inform what we recommend for schools. So it's all very important, and in this case I would say that this is positive. This is a fairly low number, I would say, of situations with cases given the very, very many child care settings that there are in the state.
Okay, thank you, Kris.
That's all the time we have for the call this afternoon. If you did have a question you were not able to get to during the call, please feel free to reach out to the MDH Communications Office this afternoon. Have a good day, and we will be back with you again Friday.
This concludes today's conference. Thank you all for participating. You may now disconnect. Connect.